Keeping on the topic of body movement and biomechanics broadly, what are some cool discoveries that have happened in the last decade or so out of your lab and out of the peer groups that you interact with? Help us understand, some ideas that have emerged that are today changing the way we look at movement.
Absolutely. Some of the coolest are also some of the simplest. So I always talk about in my own work, we look at exercise interventions to improve functional capacity and reduce falls in seniors. When you look at a senior population, 1 in 2 seniors over 80 years of age suffer a fall each year. And 1 in 3 over 65 years of age. So it is an issue that affects a broad spectrum of seniors. So what my research team has done is developed home-based exercise program that people can do in their own home to support their own living, independent living. That's the wish of most seniors. As they grow older, they want to live independently to the extent possible. So the coolest finding, I would say, is that our body is very resilient. Even at a later age of life, you can start and you can begin to gain functional capacity.
When you say functional capacity, I want to make sure our audience understands. Help us define it in a way that we can wrap our minds around it.
Absolutely. Functional capacity in the simplest term is just getting up from a chair and walking from room to room. For a young athletic person, that doesn't take any thought. But for a senior who has compromised function, that's a hard task to pursue. So the exercise program allows them to the basic capacity to get out of a chair, go from room to room, look after their own health and well-being to the extent possible. So the coolest finding is that you can do that at any age. We've had participants over 90 years who have been able to improve their functional capacity so they can go out of their house to enjoy a picnic and a party with their family. So it's a very meaningful way of addressing function and enhancing health.